Welcome, stakeholders. Today we will be discussing blood pressure awareness in San Bernardino County. We will also talk about our lifestyle support program that we'll be implementing into the community. I'm introducing Healthy Hearts San Bernardino, a community-based program focused on blood pressure awareness, screening, lifestyle support, for adults 35 to 65. Our goal is to strengthen cardiovascular health across the county by working with clinics, churches, and community partners. Everyone here is a crucial part of our program. Your involvement will help us to bring important resources to San Bernardino County's community. You may be wondering who everyone is in the room. We will take a few minutes to introduce ourselves. This will help us all be able to work together for this important service to our community. This presentation is designed for the partners who help make this work possible: local clinics, churches, nonprofit groups, community centers, grocery store partners, and potential funders. Each of you plays a different but essential role in improving health outcomes in the communities we serve. I would first like to show everyone how important it is to make sure we are taking blood pressure properly. This is important for our community, and it may be something new for you to learn and understand. There are 7 simple tips to get an accurate blood pressure reading. And these different things can affect your blood pressure by raising it. A lot of people didn't realize that you need to use the correct cuff size, because if it's too small, it will add more to your blood pressure. Put cuff on bare arm, don't put it over your clothes, which can also add more to your blood pressure. Support arm at heart level. Keep your legs uncrossed. Support your back and feet. Empty your bladder first. And don't have a conversation while having your blood pressure taken. These simple tips can help get a more accurate reading for us in our program. We are currently in the early implementation phase. A brief pilot period allowed us to test workshops and screenings. The feedback was encouraging, and now we are preparing to launch on a broader scale. Your involvement will help us reach more residents and strengthen our program foundation. The community benefits from reduced emergency healthcare use, stronger partnerships across the health and faith sectors, and improved awareness of preventative care. Over time, we hope these efforts contribute to lower rates of cardiovascular disease across the county. Hypertension is one of the most critical health issues in our region. Many adults are unaware they even have high blood pressure, which increases long-term health risks. Communities with lower access to preventative care experience higher rates of uncontrolled hypertension. This is why early detection and education are so important. Recent data show that 1 in 3 adults in California has high blood pressure, and nearly a third of them don't know it. San Bernardino County trends are even higher. During our pilot, many attendees shared that they had not had their blood pressure checked in over a year. This reinforces the need for accessible screenings. Our program focuses on adults aged 35 to 65. This age group sees rising rates of hypertension, but often face barriers to care. Hispanic, Latino, Black, and Asian communities are especially affected. Many residents struggle with transportation, language barriers, or limited healthcare access, so bringing services directly into the community is essential. The mission of Healthy Heart San Bernardino is simple: empower adults to take charge of their heart health. We do this through culturally responsive education, regular screening, and lifestyle support services. By meeting residents where they are physically and culturally, we can make heart health more accessible. Our goals reflect both awareness and long-term health improvement. First, we want to increase understanding of blood pressure control. Second, we want to support lasting lifestyle changes through activity, nutrition, and stress management tools. SMART Objective Goals 1. These objectives help us measure progress. We plan to deliver 12 multilingual workshops, increase knowledge of blood pressure ranges, improve self-monitoring habits, install community monitoring stations, and lower undiagnosed hypertension by 10% within 2 years. SMART Objective Goal number 2. For the second goal, we are building a system that encourages consistent lifestyle improvement. Peer health ambassadors will support participants, and we will measure increased physical activity, nutrition habits, and a 15% improvement in controlled blood pressure within 2 years. Our core interventions: monthly heart health workshops, mobile unit screenings, home blood pressure monitor distribution, community health ambassadors, cooking demonstrations, and nutrition coaching, self-monitoring kiosks in churches, libraries, and markets. These interventions work together to provide education and support. Workshops teach essential skills. Mobile units offer screenings. Ambassadors will help reinforce healthy habits. Nutrition sessions, cooking demonstrations, and home blood pressure monitors help participants practice these skills at home. Behavior theory, social cognitive theory. Program strategies include modeling through peer ambassadors, self-efficiency building through skill training, environmental support through kiosks and partnerships, and reinforcement through group sessions. Our programs uses social cognitive theory, which emphasizes self-efficiency, modeling, and environmental support. Peer health ambassadors are a key part of this approach. When people see others like them making progress, they are more confident in their ability to make changes. We use the Proceed planning model to guide assessment, implementation, and evaluation. This model helps ensure that our program is grounded in real community needs and that we can track progress in a structured, measurable way. To run this program, rely on staff, volunteers, curriculum materials, screening equipment, and strong community partnership. These resources make it possible to provide high-quality services at no cost to our participants. Here is our projected timeline. In the first year, We will recruit staff, expand workshops, and install self-monitoring stations throughout the second year. We will continue screenings and evaluate long-term outcomes. This steady rollout ensures that each phase is implemented responsibly. Participants benefit through early detection, better understanding of their health, and consistent support. Access to free monitors, cooking classes, activity plans, and faith-based encouragement helps remove barriers to healthy living. We welcome stakeholders' involvement in many forms. You can host an event, donate equipment, assist with outreach, offer staff support, or help promote the program. Every contribution strengthens this initiative and expands our outreach. We invite you to join us in building a healthier San Bernardino County. Together, we can expand services, reach underserved residents, and make a lasting impact on heart health. Your partnership is essential to achieving these outcomes. This concludes our presentation. I want to thank you for joining us today, and I wanted to let you know that the resources on the screen are good to go and look through. They have great information. We've used these sources to reference for our program design. They provide the evidence-based for hypertension prevention, community interventions, and best practices for chronic disease management. Thank you again for joining us, and have a blessed day.